Good afternoon, everyone. I'm Dr. Charles Odima from Nigeria. I work for a non-governmental organization, Society for Family Health, and we implement programs, health programs in Nigeria. And Society for Family Health is an organization that is about 40 years old. And I'll be presenting some of the program-based, it's a project-based implementation. I'll be presenting some of the results that we have been able to look at a cohort of children who have been co-infected with TB and HIV. And then we implemented some structural interventions for these children along the lines of social determinants for health for these children. And we were able to see some improvements in terms of their treatment outcomes, the TB treatment success rates, as well as their final viral suppression for this cohort of children. Okay, I don't have any conflict of interest to declare, but I must also declare that I don't have 34 years experience. And I've not even seen as much, not to talk of seeing it all. All right, so as I said earlier, the project we implement is funded by Global Fund, and we are currently implementing Grant Cycle 7, which spans from 2024 to 2026. Institute of Human Virology is the principal recipient of the grant, and my organization, Society for Family Health, is a sub-recipient of the grant. So in this particular study, by way of background, we found out that, as we know and has been highlighted in the course of the discussion today, that we see that TB is about 20 times higher among those who are infected with HIV compared to those who do not have HIV. And of course, for children under 15 years, we have about 11% of the global cases. And then for structural barriers that we've observed, especially in Nigeria, across resource-constrained settings, we've identified a lot of structural barriers that have, limited the access to treatment and access to interventions for especially these children who have these comorbidities. So within a period of 3 years, from 2021 till December 2024, we started to review the interventions, structural interventions that we've implemented within this cohort of children, and to assess, the outcomes of this intervention among these children and adolescents that have been infected. We assessed this in 2 broad states, Kwara and Gombe states, in about 54 health facilities. And then we also started to assess the impact of these interventions and these strategies in terms of treatment success rate for TB as well as viral suppression among this cohort of children. So some of the things we did, we have a package of program for, before now, we would talk of the OVC program. In these states, PEPFAR had implemented from 2021 till the beginning of 2024, before they transited those states to the support of Global Fund. And PEPFAR had implemented some package of these structural interventions within the OVC program. But in the Global Fund program, even though the Global Fund does not implement OVC program, some of those structural interventions were still sustained in collaboration with the government of Nigeria in those states. And we had tracked how using the structural interventions and running them across that cascade for these children, would have, contributed immensely to the successes that we saw. So some of those programs included Operation 000 Clubs. We have the viremic clinics and same-day CD4 testing for these children. We had enhanced case management for this particular cohort of children. And then also there was a screening for cryptococcal antigen screening and then laboratory investigation for this particular cohort. So for those structural interventions, there are about 5 key pillars of this intervention, cutting across health and nutrition, education for mostly those children in resource-constrained settings were out of school, We also did some intervention around mental health and psychosocial support. Then for some other children, we looked at gender, human rights, and social protection programs that we implemented for those children. And then for some that require some form of economic strengthening, we're also able to intervene and provide some of those economic system strengthening programs for these children and some of their caregivers. From the lessons learned, when we reviewed this cohort from 2021 to 2024, we have about 1,031 children who were co-infected with this, and then 13 of them were diagnosed and treated for TB. And then some of the diagnoses, laboratory systems that were used for diagnosis, we have the GeneSPACT, we have the chest X-ray, as well as the AFB, and some of them were in combination. So if you look at the demographics of those children, we have 6 males who fell within 5 to 9 and then 15 to 19 years, and then we had 7 females who fell within 10 to 19 years. We also had 3 of them that were placed on abacavir-based dolutegravir regimen, and then we have the other 11 of them on the tenofovir, lamivudine, and then dolutegravir. So when we looked at this, we saw that, like I said earlier, 11 of those children were diagnosed from GeneSPACT, and then 1 each were diagnosed from a combination of, either GeneSPACT chest X-ray or the AFB chest X-ray. And if you check that, it was about 1.26% of the total number of children that were diagnosed for TB. Then for successes, we discovered all the children were successfully treated for TB. We had a 100% treatment success rate, irrespective of the regimen that they were in. And then you could see the age disaggregation there for the children that were treated successfully for TB. And then when we now took this cohort of these 13 children and also tried to monitor their viral load cascade, we discovered that, at the end, all these 13 children were all virally suppressed. And so we came to a conclusion that, for some of these children in resource-constrained settings, most times it's the social determinant for health that affects their ability to access care. And if we go beyond the clinical management of these clients to addressing some of those social determinants for health, especially for children and adolescents, will have more success rates and then better clinical outcomes. And there's a commitment from both my organization, Society for Family Health, Institute of Human Virology, and the government of Nigeria to ensure that we scale this up even beyond 2026 within the grant life cycle. Some of these systems have already been integrated by some governments, and they've started implementing some programs across the social determinants for health, and also trying to integrate some of them into line ministries like Ministry of Education, Ministry of Women Affairs, to be able to provide some of these social services to these children within this targeted population group. So I just want to thank the Federal Ministry of Health, Nigeria, Global Fund, PEPFAR, Institute of Human Virology, my own organization, as well as other key partners that we are working in this project in 2 states in Nigeria. Thank you very much.